72-KDA type 4 collagenase, also known as matrix metalloproteinase 2, MMP2, and gelatinase A, is an enzyme that in humans is encoded by the MMP2 gene. The MMP2 gene is located on chromosome 16 at position 12.2. Function: proteins of the matrix metalloproteinase MMP family are involved in the breakdown of extracellular matrix ECM in normal physiological processes, such as embryonic development, reproduction, and tissue remodeling, as well as in disease processes, such as arthritis and metastasis. Most MMPs are secreted as inactive proproteins which are activated when cleaved by extracellular proteinases. This gene encodes an enzyme which degrades type 4 collagen, the major structural component of basement membranes. The enzyme plays a role in endometrial menstrual breakdown, regulation of vascularization and the inflammatory response. Activation of MMP2 requires proteolytic processing. A complex of membrane type 1 MMP, MT1 MMP, MMP14, and tissue inhibitor of metalloproteinase 2 recruits pro-MMP2 from the extracellular milieu to the cell surface. Activation then requires an active molecule of MT1 MMP in autocatalytic cleavage. Clustering of integrin chains promotes activation of MMP2. Another factor that will support the activation of MMP2 is cell-cell clustering. A wild-type activated leukocyte cell adhesion molecule, ALCAM, is also required to activate MMP2. Clinical significance: mutations in the MMP2 gene are associated with Torg-Winchester syndrome, multicentric osteolysis, arthritis syndrome, and possibly keloids. Role of MMP2 in chronic disease. Activity of MMP2 relative to the other gelatinase, MMP9, has been associated with severity of chronic airway diseases including idiopathic interstitial pneumonia and bronchiectasis. In idiopathic interstitial pneumonia, MMP2 activity was elevated in patients with the less severe disease phenotype, which is more responsive and reversible with corticosteroid therapy. In non-cystic fibrosis bronchiectasis, MMP2 concentration was elevated in patients with Haemophilus influenza airway infection compared to Pseudomonas aeruginosa airway infection. Bronchiectasis patients with P. aeruginosa infection have a more rapid decline in lung function. Altered expression and activity levels of MMPs have been strongly implicated in the progression and metastasis of many forms of cancer. Increased MMP2 activity has also been linked with a poor prognosis in multiple forms of cancer, including colorectal, melanoma, breast, lung, ovarian, and prostate. Furthermore, changes in MMP2 activity can come from alterations in levels of transcription, MMP secretion, MMP activation, or MMP inhibition. MMP production in many cancers may be upregulated in surrounding stromal tissue rather than simply in the tumor lesion. For instance, Mook al. showed that MMP2 mRNA levels are strikingly similar between metastatic and non-metastatic lesions in colorectal cancer, but metastatic cases are correlated with higher levels of MMP2 mRNA in surrounding healthy tissue. For this reason, it is difficult to fully understand the complex role of MMPs in cancer progression. Role in cancer cell invasion equals. One of the major implications of MMPs in cancer progression is their role in ECM degradation, which allows cancer cells to migrate out of the primary tumor to form metastases. More specifically, MMP2, along with MMP9, is capable of degrading type 4 collagen, the most abundant component of the basement membrane. The basement membrane is important for maintaining tissue organization, providing structural support for cells, and influencing cell signaling and polarity. Degradation of the basement membrane is an essential step for the metastatic progression of most cancers. Cancer cell invasion, ECM degradation, and metastasis are highly linked with the presence of invadopodia, protrusive and adhesive structures on cancer cells. Invadopodia have been shown to concentrate MMPs, including MT1 MMP, MMP2, and MMP9, for localized release and activation. Furthermore, degradation products of MMP activity may further promote invadopodia formation and MMP activity. Finally, MMP2 and several other MMPs have been shown to proteolytically activate TGF-beta, which has been shown to promote epithelial mesenchymal transition, EMT, a key process involved in cancer metastasis. Role in cell signaling MMP degradation of the ECM affects cellular behavior through changes in integrin cell binding, by releasing growth factors harbored by the ECM, by generating ECM degradation products, and by revealing cryptic binding sites in ECM molecules. For instance, MMP2 degradation of collagen type 1 can reveal a previously inaccessible cryptic binding site that binds with the alpha-v-beta-3 integrin expressed by human melanoma cells. Signaling through this integrin is necessary for melanoma cell viability and growth in a collagen matrix and can potentially rescue the cells from apoptosis. As another example, cleavage of laminin 5, a component of the basement membrane, by MMP2 has been shown to reveal a cryptic site inducing migration of breast epithelial cells. More generally, by degrading the ECM, MMPs release growth factors that were previously bound to the ECM, allowing them to bind with cell receptors and influence cell signaling. Furthermore, many MMPs also activate other prompts along with growth factors. MMP2 has also been shown to cleave other non-ECM substrates including growth factors such as TGF-beta, FGF receptor 1, ProTenF, IL-1-beta and various chemokines. For instance, MMP2 has been implicated, along with MMP9 in cleaving latent TGF-beta, which has complex interactions with cancer cells. TGF-beta generally plays a role in maintaining tissue homeostasis and preventing tumor progression. However, genetically unstable cancer cells can often evade regulation by TGF-beta by altering TGF-beta receptors in downstream signaling processes. Furthermore, expression of TGF-beta is also correlated with immune tolerance and may help shield cancer cells from immune regulation. Role in neovascularization and lymphangiogenesis MMP2 also plays an important role in the formation of new blood vessels within tumors, a process known as angiogenesis. This process is essential for tumor progression, because as tumors grow they need increasing supplies of oxygen and nutrients. Localized MMP2 activity plays an important role in endothelial cell migration, a key feature of angiogenesis. Additionally, MMP9 and other MMPs have been suggested to also play a complex, indirect role in angiogenesis by promoting VEGF mobilization and generating anti-angiogenic factors. For instance, when studying carcinogenesis of pancreatic islets in transgenic mice, Burgess et al. Showed that MMP2 and MMP9 were upregulated in angiogenic lesions and that the upregulation of these MMPs triggered the release of bioactive VEGF, a potent stimulator of angiogenesis. Additionally, the group determined that MMP2 knockout mice showed decreased rates of tumor growth relative to tumor growth rates in wild-type mice. Furthermore, increased expression and activity of MMP2 has been tied to increased vascularization of lung carcinoma metastases in the central nervous system, which likely increases survival rate of these metastases. Finally, MMP2 has been also shown to drive lymphangiogenesis, which is often excessive in tumor environments and can provide a route of metastasis for cancer cells. The tree al. Showed that knocking down MMP2 in zebrafish prevented the formation of lymphatic vessels without altering angiogenesis, while MMP2 inhibition slowed the migration of lymphatic endothelial cells and altered the morphology of new vessels. These results suggest that MMP2 may alter tumor viability and invasion by regulating lymphangiogenesis in addition to angiogenesis. Inhibition of MMP2 as cancer therapy . Clinical trials for cancer therapies using MMP inhibitors have yielded generally unsuccessful results. These poor results are likely due to the fact that MMPs play complex roles in tissue formation and cancer progression. And indeed, many MMPs have both pro- and anti-tumorigenic properties. Furthermore, most clinical studies involve advanced stages of cancer, where MMP inhibitors are not particularly effective. Finally, there are no reliable biomarkers available for assessing the efficacy of MMP inhibitors, and MMPs are not directly cytotoxic, so they do not cause tumor shrinkage. So it is difficult for researchers to determine whether the inhibitors have successfully reached their targets. However, initial clinical trials using broad-spectrum MMP inhibitors did show some positive results. Phase 1 clinical trials showed that MMP inhibitors are generally safe with minimal adverse side effects. Additionally, trials with marimestat did show a slight increase in survival of patients with gastric or pancreatic cancer. Various research groups have already suggested many strategies for improving the effectiveness of MMP inhibitors in cancer treatment. First, highly specific MMP inhibitors could be used to target the functions of specific MMPs, which should allow doctors to increase the treatment dosage while minimizing adverse side effects. MMP inhibitors could also be administered along with cytotoxic agents or other proteinase inhibitors. Finally, MMP inhibitors could be used during earlier stages of cancer to prevent invasion and metastasis. Additionally, tumor overexpression of MMPs can be used to potentially target the release of chemotherapeutic agents specifically to tumor sites. For instance, cytotoxic agents siRNA could be encapsulated in liposomes of viral vectors that only become activated upon proteolytic cleavage by a target MMP. Finally, the tumor-targeting properties of MMP inhibitors offer a potential strategy for identifying small tumors. Researchers could couple MMP inhibitors to imaging agents to help detect tumors before they spread. Though initial trials yielded disappointing results, MMP inhibitors offer significant potential for improving cancer treatment by slowing the process of cancer cell invasion and metastasis. Interactions. MMP2 has been shown to interact with references. Further reading. External links. The MEROPS online database for peptidases and their inhibitors. M10.003